we are looking at the functions of major muscles. The first muscle we'll be looking at is pectoralis major. In the pectoralis major, some fibers, some fibers come from the top, like what you're seeing here. Some fibers are coming from the top, some fibers are coming from the middle, some fibers are coming from the bottom here. So the fibers which are coming from the top make you do shoulder flexion. The fibers which are coming from the middle are making you do shoulder horizontal flexion. Also, the fibers in the middle are mostly making you do shoulder internal rotation. The lower fibers are making you do shoulder adduction and shoulder extension. So these are the primary functions of the pectoralis major. So we have summed it up here. These are the major functions of the pectoralis major. The next muscle that we are looking at is the trapezius. Trapezius, though it's a single muscle, we have divided it into upper trapezius, middle trapezius, and the lower trapezius. The upper trapezius lift the scapula upwards. We say elevation of the scapula. This is the reason why you do shrugs for that. The middle trapezius is making you do retraction of the scapula. That means pulling the scapula blades close together. So therefore we do any kind of these horizontal rows. And the lower fibers are going to depress the scapula and do an upward rotation of the scapula. So we do high pulley rows for the lower trapezius. So those are the major functions of the trapezius as we've shown here. Next we have the deltoid. This deltoid is divided into anterior deltoid, this part. We have the middle deltoid, we have the posterior deltoid, like that. The anterior deltoid is making you do shoulder flexion and shoulder horizontal flexion. And obviously, the posterior deltoid being the exact opposite does the exact opposite, which is shoulder extension and shoulder horizontal extension. Whereas the middle fibers here are making you do shoulder abduction. This is the reason why for the anterior deltoid, you will do the front raises or you will do pec fly. Whereas for the posterior deltoid, you will do reverse pec fly or you will do say a dumbbell pullover or something like that. For the middle fibers, you will do side lateral raise. The next muscle that we'll be seeing is latissimus dorsi. The latissimus dorsi, because it is coming from the back and the insertion is very, very close to the pectoralis major, there are a lot of functions which overlap. So the work of the latissimus dorsi predominantly is shoulder extension, shoulder abduction, horizontal abduction, and internal rotation. So if you look at this, your pectoralis major also did this. Your pectoralis major also did this. Pectoralis major also did this. So only this one here is the opposite, whereas the other three are common between latissimus dorsi and pectoralis major. That's why some of the exercises like your pullover and so on would work both your latissimus dorsi and pectoralis major. The next muscle is bicep. The work of the bicep, because it's crossing two joints, the major work is elbow flexion, and it also does shoulder flexion to a limited range. Next, we have the tricep. The tricep is also crossing two joints. It's crossing the shoulder joint. It's also crossing the elbow joint. So the major work is elbow extension, but it can also do the shoulder extension. Next muscle, rectus abdominis. This is the most superficial anterior torso muscle. The work of this is trunk flexion against resistance. Next, we have external oblique and the internal oblique. They always work together. The external internal obliques, if the opposite side external oblique and the opposite side internal obliques work, they make you do trunk rotation like in wood chops. But the same side external internal obliques, if they work, they make you do a lateral flexion like how you do in side bends. Next, within this, you have a muscle called as transverse abdominis. The work of the transverse abdominis is to provide stability to your trunk. The next muscle is erector spinae muscle group. This is at the back of, this is right next to the spine, posterior side. The work of erector spinae is to do trunk extension. Next, we have the quadricep muscle. Quadricep is actually made up of 4 different muscles. We have the rectus femoris, we have vastus lateralis, vastus medialis, and vastus intermedialis. Out of these, the master muscle is the rectus femoris because this crosses 2 joints. It crosses the hip joint and the knee joint. The work of the quadricep muscle, particularly rectus femoris, is knee extension and hip flexion. But the other 3 are only doing the knee extension. But in totality, quadricep is doing both hip flexion and knee extension. The next muscle that we will see is the hamstring muscle. Hamstring is actually made up of 3 different muscles. One is bicep femoris, the next one is semitendinosus, and then semimembranosus. All of them do the knee flexion and hip extension. Next, we have the gluteus maximus. The gluteus maximus starts out from the sacrum region, ends up on the femur. The work of gluteus maximus is hip extension and hip external rotation. The next muscle that we'll be looking at is gastrocnemius. Gastrocnemius starts out from the end of the femur, attaches itself to the calcaneus, the heel region. So the work is majorly plantar flexion and a little bit of knee flexion. We have another muscle which is called a soleus, which does not start from the femur but attaches to the same Achilles tendon. So therefore, the soleus only does plantar flexion. Next, we have the exact opposite muscle, which is on the anterior side, which is called as anterior tibialis. The work of anterior tibialis is a dorsiflexion of the foot, also inversion of the foot.